I brought you into a room where I have a special table, and I was able to give you a osteopathic manipulative treatment.
Right, and that's what made that's cracking sensation.
Right, right.
But it relieved the pain.
Right.
You know. All right. Now, I think what we could do to help people is give them some illustration of the most common diagnosis of lower back pain.
Right.
By using our friend here.
Right, right, right.
Okay. All right.
Okay. Well, we're going to define first the most common diagnosis for low back pain is usually a lumbosacral strain sprain. And before I demonstrate on the model that a strain would relate to muscles, so it'd be muscular strain, and then the sprain is related to the ligaments.
Right.
So people will get that confused where they think they strained a ligament. No, you sprain a ligament and you strain muscles. So, but you can have a combination of both leading to low back pathology or low back pain.
Okay.
So right here we have our mannequin or our skeleton, and I just want to demonstrate and point out the areas that we're talking about within this particular topic. We're talking about low back pain. Low back pain is usually your lumbar and sacral spine, and I'm going to point out this area of the spine from here to here would be your lumbar spine, and this section right here is called the sacrum, and then you have the coccyx. But this is what we call the lumbosacral junction, and this is where a lot of pathology occur, meaning at your lower back pain.
Right.
And the area that we're talking about, the lumbosacral strain or sprain, would be in this area right in here on both sides, one or the other, and that's very common. Okay.
So, any problems you have are going to be in this particular area right
Right,
now?
it would affect this area of the spine right here. I mean, you can have back pathology of back pain from the cervical spine all the way down to the coccyx, but for this particular topic we're discussing just the lumbosacral junction in this area here, because we're talking about lower back pain.
Right, and what causes a lower back strain? Back to some of the causes, because people need to know what they may have done, because sometimes I don't know what I did.
Right.
Okay, but what are some of the causes?
Well, causes can range from a simple urinary tract infection, not that the pathology is in the low back, but you have the referred pain that leads to the low back, and then we treat the pathology, which is the urinary tract infection. That would be one. The next would be an actual lifting of something, a twisting, a turning at work, and lifting something heavy in not using the proper biomechanics, and that will lead to pain. That's probably the most common cause. You also have a motor vehicle accident where you have this high velocity movement, and which
jerk or something.
Yes, it's called an acceleration deacceleration. In the neck we'd call that whiplash, but you can have that same pathology or same physiological effect in the low back, where you have this increased speed, then all of a sudden the seatbelt kicks in and it jerks you back, and then you had that deceleration. Or it could be not the seatbelt, you hitting a wall or another car, where you had that impact where your forward momentum slows down, and that you have a jerking sensation in your lower back and everything shifts.
But what happens when that happens? Something shifts out of place here, or what?
Well, that could be one. It could be that you have the muscles from that instant deceleration or that very sharp, short period of time where you have that deacceleration, where your muscles tighten up so tight that it throws you back into a spasm and pulls the bones, out of alignment a little bit. It would be a small distance. It's not a lot, but enough that's significant to cause you pain. Or it could pull on the ligaments. So I was talking muscle. Now I'm talking about the ligaments themselves. The ligaments attached to the bones from bone to bone. When you have the bones that are out of alignment, just a little bit, they pull on the ligament, and that ligament could cause pain.
Right. Now, what about obesity? Obesity
and pregnancy, I'm going to use them both in the same example because the pathology is is similar. I'm going to turn this to the side. When we're obese or
overweight,
overweight, obese or morbid obesity, or as well as women who become pregnant, you have an increased area in here, right? This is your stomach, your abdomen. Well, when you have an increase in size in the abdomen, the lumbar spine here, this lumbar spine, the biomechanics change. We have what's called an increased lordosis. And a lordosis is a curvature, what we call anterior, meaning it's going forward. This curvature here goes forward.
Right, because the weight is here.
Right. So what happens is the lumbar spines, the biomechanics change. So the angles start to shift and change. So the more overweight we become, we go from overweight to obese, from obese to morbid obesity, the biomechanics change and your center of gravity changes. The same thing with pregnant women. As the months at a gestational period, meaning the time that they're pregnant, as their pregnancy gets longer and longer or further along, closer to 9 months, the biomechanics in the lumbosacral junction change. And this is this area, again, what we're talking about, the lumbosacral junction. When this changes, you start to have stress in this area, and the ligaments start to strain. Well, in that particular sprain, because we're talking about ligaments, and that causes pain. And with pregnant women, there's more to it than that. We have hormones that are being released. They're called elastin, that particular hormone, and that allows the body and the pelvis to stretch. That's because of the hormones, and that causes pain.
Understood. Now, what, of course, losing weight would be the best method, but is there also a precaution on how you pick things up, how you, with this extra weight, there's a certain therapeutic situation that you could help, that could help the people. Could you explain that?
Right. Well, first,
the therapy in it, because I know, I guess that would be called osteopathic manipulation.
Right. Well, that's one way of treating it. Again, first and foremost, we do a thorough history and physical. We need to find what the pathology is, what the initial problem is. Then once we're able to find out what the problem is, then we have to address it. I'll give you an example. Obesity. We see there's a change in biomechanics. You know, I do a thorough exam, a thorough musculoskeletal exam. I point out the areas where the condition is, and then we address the obesity aspect. First and foremost, we have to address diet modification, lifestyle change, increased exercise.
What would be lifestyle change? How would that?
Well, lifestyle, when I refer to lifestyle, I'm talking about sedentary, someone who's a couch potato, someone who works a 9-to-5 job, or might not work at all because they're retired, or who are disabled, and they basically just sit around. They might be on a computer all day long, or that could be their profession, versus someone who is, they come home from work and they just watch TV all day. They eat and they watch TV. They're not active.
Yeah, because my wife was having a problem like that, doing computer work in one position. And then she's, you know, after a while she started getting back pains. And I said, well, you need to change your position or move the computer to a different angle. Was that a good advice?
Yeah, that's part of biomechanics. The proper seating arrangement, the table has to be at the proper height, so you don't develop carpal tunnel syndrome, which would be another topic at another time, as well as low back pain. You know, we need to have lumbar supports, and you could buy these, let's say if you work on a computer all day and you're in a chair, and you're starting to develop low back pain, you can go out, you know, and you know, get supports. But before you do that, you always have to, and I suggest that you go and you see your doctor to make sure there's no other pathology first before you self-treat. And that's key. You must speak and see your physician, have a thorough exam, that including lab work, a urine exam, as well as a musculoskeletal exam, sit